Erectile dysfunction, often referred to as ED, is a condition that affects millions of men worldwide. It's more common than many realize and can have a significant impact on quality of life and relationships. But what exactly causes ED? In this video, we'll explore the most common triggers, helping you understand what might be behind this condition. By recognizing these factors, you can take steps toward prevention and seek the right support. Let's begin by looking at the basics of how erections work and why things sometimes go wrong. To understand erectile dysfunction, it's important to know how erections normally happen. When a man is sexually aroused, nerves release chemicals that increase blood flow into the penis. The blood fills two chambers inside the penis, causing it to become firm. If anything disrupts this process, whether it's physical, psychological, or a combination, ED can occur. Now, let's dive into the most common triggers that can interfere with this natural process. Physical causes are among the most common triggers for erectile dysfunction. These include health conditions that affect blood flow, nerve function, or hormone levels. Chronic illnesses, injuries, or surgeries can all play a role. Let's break down the most significant physical factors, starting with cardiovascular disease. Cardiovascular disease is a leading cause of ED. Conditions like high blood pressure, atherosclerosis, hardening of the arteries, and heart disease can restrict blood flow to the penis, making it difficult to achieve or maintain an erection. Since the arteries in the penis are smaller than those in other parts of the body, ED can sometimes be an early warning sign of heart problems. Maintaining heart health is crucial for sexual function. Diabetes is another major physical trigger for erectile dysfunction. High blood sugar levels can damage blood vessels and nerves that control erections. Men with diabetes are significantly more likely to experience ED, and the risk increases the longer they have the condition. Good blood sugar control and regular medical checkups can help reduce this risk. Obesity is closely linked to erectile dysfunction. Excess body fat can lead to hormonal imbalances, inflammation, and increased risk of diseases like diabetes and heart disease, all of which can contribute to ED. Losing weight through healthy eating and regular exercise can improve sexual function and overall health. Hormones play a vital role in sexual function. Low testosterone, thyroid disorders, or other hormonal imbalances can trigger ED. Symptoms may include reduced libido, fatigue, or mood changes. Treating underlying hormonal issues can often restore normal erectile function. Neurological conditions such as Parkinson's disease, multiple sclerosis, or spinal cord injuries can interfere with the nerve signals needed for an erection. These disorders disrupt communication between the brain and the penis, making it difficult to achieve or maintain an erection. Addressing the underlying neurological issue is key to managing ED in these cases. Certain medications can have side effects that include erectile dysfunction. Drugs for high blood pressure, depression, anxiety, and even some antihistamines can interfere with sexual function. If you suspect your medication is causing ED, consult your doctor before making any changes. Alcohol, tobacco, and recreational drugs can all contribute to erectile dysfunction. Excessive alcohol use depresses the nervous system, while smoking damages blood vessels. Illicit drugs can also interfere with sexual function. Reducing or eliminating these substances can improve ED and overall health. Injuries to the pelvic area, spinal cord, or penis itself can damage nerves, blood vessels, or tissues necessary for erections. Surgeries for prostate, bladder, or colorectal cancer may also affect sexual function. Rehabilitation and medical interventions can sometimes help restore function. Not all causes of erectile dysfunction are physical. Psychological factors can be just as influential. Stress, anxiety, depression, and relationship issues can all play a role in triggering or worsening ED. Let's explore these psychological triggers in more detail. Performance anxiety is a common psychological trigger for ED. Worrying about sexual performance can create a cycle of anxiety and failure, making it even harder to achieve an erection. This anxiety can stem from past experiences, pressure to satisfy a partner, or low self-esteem. Addressing these concerns through therapy or open communication can help break the cycle. Everyday stress, whether from work, finances, or family, can take a toll on sexual function. Stress increases levels of hormones like cortisol, which can interfere with the signals needed for an erection. Managing stress through relaxation techniques, exercise, or counseling can improve both mental health and sexual performance. Depression can significantly affect sexual desire and performance. It often leads to a lack of interest in sex and can make it difficult to become aroused. Antidepressant medications can also contribute to ED. Treating depression with therapy, medication adjustments, or lifestyle changes can help restore sexual function. Problems in a relationship, such as poor communication, unresolved conflicts, or lack of intimacy, can contribute to ED. Emotional distance or tension with a partner can make it difficult to feel aroused or connected. Couples therapy or open dialogue can help address these issues and improve sexual health. Low self-esteem or negative body image can undermine sexual confidence and contribute to ED. Men who feel insecure about their appearance or abilities may avoid intimacy or experience anxiety during sexual activity. Building self-confidence and addressing insecurities can have a positive effect on sexual performance. Past experiences of sexual trauma or abuse can have lasting effects on sexual function. These experiences may lead to anxiety, fear, or avoidance of intimacy, all of which can contribute to ED. Professional counseling and support are essential for healing and improving sexual health. Sleep disorders like insomnia or sleep apnea can also trigger erectile dysfunction. Poor sleep affects hormone levels, mood, and energy, all of which are important for sexual function. Treating sleep problems can lead to improvements in ED and overall well-being. Chronic illnesses such as kidney disease, liver disease, or cancer can impact sexual health. These conditions may affect blood flow, hormone levels, or cause fatigue and stress, all of which can contribute to ED. Managing chronic illnesses with medical support is crucial for maintaining sexual function. Aging is a natural factor that increases the risk of erectile dysfunction. As men get older, blood flow decreases, hormone levels change, and the risk of chronic diseases rises. While ED becomes more common with age, it's not inevitable. Healthy lifestyle choices can help maintain sexual function. Lifestyle choices such as poor diet, lack of exercise, and insufficient sleep can all contribute to ED. These habits affect blood flow, hormone balance, and overall health. Making positive changes in daily routines can significantly reduce the risk of erectile dysfunction. A sedentary lifestyle, or lack of physical activity, is a significant risk factor for ED. Regular exercise improves blood flow, boosts mood, and helps maintain a healthy weight, all important for sexual health. Even moderate activity can make a difference. A diet high in processed foods, sugar, and unhealthy fats can contribute to ED by increasing the risk of obesity, diabetes, and heart disease. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins supports overall and sexual health. While moderate alcohol consumption may not cause problems, excessive drinking can lead to erectile dysfunction. Alcohol depresses the nervous system and impairs blood flow, making it harder to achieve an erection. Cutting back on alcohol can improve sexual performance. Smoking is a major risk factor for ED. It damages blood vessels and reduces blood flow to the penis. Quitting smoking can lead to significant improvements in erectile function and overall health. Recreational drug use, including substances like cocaine, marijuana, and opioids, can interfere with sexual function. These drugs may affect the nervous system, hormone levels, or blood flow, all of which are important for erections. Avoiding recreational drugs is important for sexual and overall health. Chronic stress, whether from work, relationships, or other sources, can have a long-term impact on sexual health. Stress hormones interfere with the body's ability to respond to sexual stimulation. Managing stress through healthy coping strategies is essential for preventing ED. Generalized anxiety disorder, social anxiety, and other anxiety conditions can make it difficult to relax and enjoy intimacy. Anxiety can cause physical symptoms like rapid heartbeat and muscle tension, which interfere with sexual arousal. Treatment can help reduce anxiety and improve sexual function. Fatigue from overwork, lack of sleep, or chronic illness can reduce sexual desire and performance. When the body is tired, it's harder to become aroused or maintain an erection. Prioritizing rest and self-care can help restore energy and sexual function. Low libido, or reduced sexual desire, can be both a cause and a result of ED. Factors like hormonal imbalances, depression, or relationship issues can lower libido. Addressing the underlying cause can help improve both desire and erectile function. Peyronie's disease is a condition where scar tissue develops inside the penis, causing it to bend and sometimes making erections painful or difficult. This physical change can lead to ED. Treatments are available to help manage symptoms and improve function. Prostate problems, including enlargement or cancer, can affect sexual function. Treatments for prostate conditions, such as surgery or radiation, may also lead to ED. Discussing options with a healthcare provider can help manage these effects. Vascular diseases, which affect blood vessels, are a major cause of ED. Conditions like peripheral artery disease or high cholesterol can restrict blood flow to the penis. Managing vascular health through medication, diet, and exercise is important for preventing ED. Endocrine disorders, such as thyroid disease or pituitary gland problems, can disrupt hormone production and lead to ED. These conditions may also cause other symptoms like fatigue or weight changes. Treating the underlying endocrine disorder can improve sexual function. Living with chronic pain can make sexual activity uncomfortable or unappealing, leading to ED. Pain medications may also have side effects that affect sexual function. Managing pain and discussing options with a healthcare provider can help. Testosterone is the primary male sex hormone, and low levels can lead to ED. Symptoms may include reduced libido, fatigue, and mood changes. Testosterone replacement therapy may be an option for some men, but it's important to discuss risks and benefits with a doctor. Both high and low blood pressure can affect erectile function. High blood pressure damages blood vessels, while low blood pressure may not provide enough flow for an erection. Managing blood pressure through medication and lifestyle changes is important for sexual health. High cholesterol can lead to plaque buildup in blood vessels, restricting blood flow to the penis. This can make it difficult to achieve or maintain an erection. Lowering cholesterol through diet, exercise, and medication can help prevent ED. Sleep apnea, a condition where breathing repeatedly stops during sleep, is linked to ED. It disrupts hormone production and reduces oxygen supply, both of which are important for sexual function. Treating sleep apnea can improve energy, mood, and erections. Dehydration can reduce blood volume and lower blood pressure, making it harder to achieve an erection. Staying hydrated is a simple but often overlooked way to support sexual health. Many prescription and over-the-counter medications can have side effects that include ED. These may include drugs for allergies, depression, high blood pressure, and more. Always talk to your doctor if you suspect a medication is affecting your sexual health. Surgeries involving the pelvic area, prostate, or spine can sometimes result in ED due to nerve or blood vessel damage. Discussing risks and recovery options with your healthcare provider is important before any surgery. Exposure to environmental toxins, such as pesticides or heavy metals, can affect hormone levels and blood flow, increasing the risk of ED. Limiting exposure and maintaining a healthy environment can help protect sexual health. Erectile dysfunction can be triggered by a wide range of physical, psychological, and lifestyle factors. Understanding these common triggers is the first step toward prevention and effective treatment. By maintaining a healthy lifestyle, managing stress, and seeking medical support when needed, most men can improve or prevent ED. Remember, you're not alone. Help is available, and positive changes can make a real difference.